The next class is the calcium channel blockers, so CCBs. So the calcium channel blockers, how do they act? So the calcium channel blockers, they actually block the entrance of calcium through the calcium channel receptors. So normally the extracellular calcium goes into the cells through calcium channels, and then once it enters the cells, then it makes, for example, the muscle cells to contract. That's pretty much it what it does. It blocks all this process. So there is muscle relaxation. There are different types of calcium channel blockers and they can act and have their specificity for different tissues. So we have non-dihydropyridine calcium channel blockers and dihydropyridine calcium channel blockers. So we can call them dihydropyridine calcium channel blockers and non-dihydropyridine calcium channel blockers. Some examples of the first ones are, for example, nifedipine and amlodipine, whilst the non-dihydropyridine calcium channel blockers, they are diltiazem and verapamil. And it's very important to distinguish between these two classes because they will have very different effects. So, for example, the dihydropyridine calcium channel blockers, the nifedipine and amlodipine, they act mainly on the vascular smooth muscles. So basically, they make the cells to relax, the muscle to relax, it doesn't contract. Vasodilation. And then we have lower systemic vascular resistance, so we have a lower blood pressure. Lower systemic vascular resistance, lower blood pressure. Whilst the non-dihydropyridine calcium channel blockers, diltiazem and verapamil, they act more on heart level, so they can either act on the myocardium, on like the coronary vasculature, or they can also act on the nodal system or nodal conduction system. So diltiazem, it acts more on the coronary vasculature, so it decreases the heart rate, and if the heart rate is decreased, then we have the blood pressure decreased as well, whilst the verapamil acts more on the nodal conduction, so it blocks the system that makes the heart to pump. So basically reduce the heart rate. It's called a negative inotropic effect. So our cardiac output is reduced and our blood pressure is reduced as well. So that's pretty much their mechanism of action. Then when we talk about side effects, they are also different. So for the nifedipine and amlodipine, they cause mainly vasodilation, as we've seen. So the main side effects are hypotension, postural hypotension. So basically, if there is like a huge vasodilation that is detected by the baroreceptors, then our blood pressure may drop very quickly, and then people may feel like fainting. These drugs, they can cause edema, peripheral edema. The patients can suffer swollen ankles, that's like a possible side effect with them, or even swollen gums is also a possible side effect, so it's called the gingival hyperplasia. So they are the main side effects with the dihydropyridine calcium channel blockers. Then when it comes to diltiazem and verapamil that act mainly on the heart system, the main side effect is bradycardia. Bradycardia. The heart rate may drop too much, so that's pretty much the main side effect. And for verapamil, it can also block the entrance of calcium in our bowels, basically in the gastrointestinal system, so it can also cause constipation in a few patients, so constipation. If you like this video, just give it a big thumbs up, subscribe to the channel and stay tuned. See you soon!